So I'm Suzanne Phelan from California Polytechnic State University and also Brown University, and I just talked about findings from the National Weight Control Registry, which is a large sample of individuals who've lost a significant amount of weight and kept the weight off in the long term. And I described some of the key characteristics of these individuals, and that includes they're consuming a low-calorie, low-fat diet. They have high dieting consistency, not a lot of variety in terms of their dietary food choices. They eat breakfast, they don't have a lot of fast food. And in terms of their physical activity, they're doing a lot of physical activity, 60 to 90 minutes a day of physical activity, about 11,000 steps a day of physical activity. They have a healthy home food and exercise environment, a lot of pieces of exercise equipment in the home and healthy foods in visible locations, and they're not watching a lot of TV and they don't have a lot of televisions in the home. So I reviewed some of these data today.
So it certainly can be a challenge to tackle pediatric obesity in the office, especially when you're have just a short time for a visit. And so one of the main things that we covered today was that you can help families to make one or two simple changes that can have lasting effects on BMI. And so, for example, decreasing sugar-sweetened beverages is a very important change that's been proven to improve BMI in adolescents. Another good one is decreasing television time and then encouraging families to eat at home. And they seem like simple things, but if you take the time to address this in your office, you can really make a difference. The AGA has recently published a book called The No Diet Obesity Solution for Kids, and this is a nice resource that you can use for the patients in your office. It has a description of simple changes that parents can make and advice for them on how to get started with this problem.
So today we talked about bariatric procedures and their role, not just the procedure itself, but who the procedure is good for, when we should do it, and we talked a little bit about what procedure was best. There are a number of procedures that are fairly established, such as the gastric bypass, the duodenal switch, and then other more novel things that are just being studied, such as the sleeve gastrectomy and other methods. We talked about the appropriate patient selection, that bariatric procedures are probably the only proven treatment for medically complicated obesity. Patients with a BMI of 35 or greater with comorbidities clearly receive benefit in terms of reduction of comorbidities and some survival data showing improved survival. These procedures can be done safely, predominantly laparoscopic today as opposed to in the past, and probably the most important approach to patients for surgery is the multidisciplinary approach, where all patients with medically complicated obesity are evaluated in a multidisciplinary center to receive all the appropriate preparation and counseling to be able to understand and have long-term success from these procedures.